Got a question about that.
Yeah.
We're called trust-driven care, and we're really big about like building that trust with patients. And a very common place that can be fractured is where somebody comes in, they're referred to Dr. Annie, they see Dr. Annie, and then at some point you want to hand them off. And I feel like a lot of providers and a lot of offices completely drop the ball there. And it almost feels like a brush off to the patient. Like now you're second class and you're going to go with these people. When you said you do a great job of doing this, what things did you learn really matter, and what's a really good way to make it like they're climbing to the next step rather than getting pushed off because like it's to a lower level provider? I say that with quotation marks for those listening, like I'm quoting a lower level provider. A lot of times that person's probably better at exercise than you are these days, right? Like,
Absolutely.
yeah.
And I don't have a problem telling a client that, but I introduce our model, of course, in the beginning. And I
Mhm.
tell them that it's really just them getting extra care, extra service, extra help.
Mhm.
And I really feed in the language and the findings from the athletic trainer, and we feed each other back and forth. So I'll say something along the line of like, Kelsey's working on getting your glute medius active again. She saw this in your gait. I'm going to work on this. She's going to work on that, and I make it very inclusive. And I simply, the other thing is I just simply don't offer longer treatments, right? So I tell them they're going to get more care. They get bigger, fatter treatments. They get a juicier visit per se, right? So I make it sound very attractive. And I have, of course, very amazing athletic trainers. They're well skilled, they're well versed. Clients love them.